Well, a couple of things. First of all, I'm not used to people sitting in the front row, so I'm a little freaked out here, just so you know. But thank you so much for coming. I'd like to really take a couple minutes and thank a few people, right? So one, Mr. Wallace for the great job that he did, so thank you. Two, Mr. Krieg, right? Because it's Mr. Krieg and the MD Expo TechNation that provides this opportunity for us. So I really want to do that. Third, happy Veterans Day. And for those of you that like to acknowledge it, want to say that you're a vet, please raise your hand so that we can acknowledge you. And thank you very much. Thank you for your service, and I certainly appreciate everything that you've done for us. Okay, so what we're going to do today is I'm going to try to share with you a little bit about my perspective of what I think it takes to be successful. It's really interesting. Some of you may have noticed this before we got started. I walked around the room, I introduced myself, and I said hi. It also gave me an opportunity to get to meet you a little bit, and I can see where you're from and what you do, and it gives me a chance to kind of make it more interactive, make it more about you and what you do and how you do it. So thank you. Interesting. So like I said, young lady back here, which didn't recognize it first, but we actually worked together quite a while ago when I was at Sodexo. So I will try to refer to things that actually might be germane and pertinent to you so that this can be more valuable. My goal today is to give you one small aspect of what I personally believe is what can make somebody successful. There's a lot of things that make you successful in this industry, your technical skills, your abilities to be able to be flexible and do things. But one of the biggest things I think is communication. We all talk, we all hear things, we don't necessarily communicate very well. And it's my goal, hopefully, to spend a little time with you today to make that happen. A little bit about me, good, bad, or indifferent. I'm an old guy, been around for 43 years in this industry. I've worked for virtually just about every ISO there is. So that includes Aramark, Trimedics, Crothall, Sodexo, Crest Services, TKA. I've been around. Some think that's a good thing, and some think that's a bad thing. It's hard for me to keep a job, I guess. But honestly, I've left because I've always had better opportunities, and that's what I want to do. And I'll also give you that one other piece of tidbit, if I could. Your flexibility, and what I mean by flexibility is several things. One, be willing to do a little bit of extra. Say yes when something needs to be done. If you can, be willing to move. If you're willing to move, the sky's the limit. It's so hard to find people in this industry that are willing to relocate to do the job. And I was willing to do that, and it's helped me out tremendously. And I would encourage you all to think about it and consider that as well. Okay, so let's talk a little bit about what we're here for. By the way, this is interactive. Please stop me at any time, ask any questions you want, and see if we can't help each other out. I want to thank you all for being here, by the way. I forgot that. You guys taking your time to be here, to invest in yourselves. You can't do anything that's more important. I can't encourage and thank you enough for doing that. So please continue to do that. When you stop learning, you stop living, as far as I'm concerned. So a couple things. In the next hour, we're going to walk through a whole bunch of stuff. But in all candor, we're barely going to scratch the surface. There are people that they spend their entire careers talking about what we're going to talk about in an hour. My goal would be for you to get jazzed up and excited enough that you leave here and want to go turn to something else and learn a little bit more about it. Happy to talk to you about it. You're welcome to go off and learn it on your own. I'm going to give you some information, but we are barely going to scratch the surface. As I said, people spend their entire careers just focusing on one of the aspects that we're going to touch on today. Primarily, we're going to focus on the different types of listening and the communication skills. Oh, here we go. Oh, this ought to be fun in this room. So we're gonna do. Who's heard of the telephone game, right? So we're gonna play that a little bit. It's a little lopsided, left and right side, but we'll go ahead and do it anyways. But I think you're gonna find it interesting. As we all know, as we played when we were kids, how it starts out and how it ends up is entirely two different things. Well, a lot happens like that in life, right? Especially as field service engineers. We've got a customer that has a problem. They need somebody to take care of it, and they communicate that. Maybe it goes to your call center coordinator. Maybe it comes directly to you, whatever the case is, but it usually goes through 3 or 4 people. A clinician tells a manager, the manager tells a coordinator calls a service tech. They may call the dispatch center. By the time it gets down the road, it's usually pretty significant. But we're going to talk about personalities, communication, listening, and why is this thing not doing what I want to do here? And nonverbal and verbal communication. So let's, all right, let's start here. So Roger, sir, you read that as many times as you want. You leave it here and just communicate it along the way. Okay, just see, yeah. See, and so by the time it gets back there, we'll have a conversation about what that looks like. We'll do the same thing on this side. Read it as many times as you want. You can even read it to him, but keep the paper here after that. And then you guys just communicate that throughout the process. Something tells me it'll be a little bit different by the time we get to the end of the room. I could be wrong. Prove me wrong. Okay, what you see up here is everyday life. And I'm going to try to pertain everything that I talk about is around field service, technicians, clinicians, trying to figure out how we can ultimately do what I think we get up every day to try to go do to work. And that is to make sure that our patient care equipment is working the way it was designed and intended, and is doing the job that we all want it to do so that patients can be taken care of. So just for the sake of discussion, I got a technician talking to a radiology clinician, talking to a ICU nurse, bedside monitor, talking to an OR technician. Doesn't matter what it is. Doesn't matter where you work. The matter is communication. Somebody has a problem that they need to tell you about. You need to understand that problem and be able to figure out what you need to do to fix it, and then communicate back around what you did and then what you can do to try to prevent it from happening again. It's pretty simple as you talk about it. It's not so easy as we try to do it. And now we're going to talk about a bunch of ways as to why that is. Let's talk about personality. What makes up our personality? We all have one, by the way. And so throughout this presentation, the next however many more minutes, I want you guys to be processing, how does this impact me? How is this affecting what I do? How is this something that is what I live with? So your personality is something that you pretty much acquire throughout your growing up, your childhood, whatever the case is. Your personality is influenced by your parents, your family, your friends, your elementary friends, your college friends. It all plays part and parcel to your personality. And we all are impacted differently. We all have different lives, and it will play a significant role in our ability to be able to accept or not be able to accept the way we communicate. So who here has heard of these two in particular, either Myers-Briggs or DISC? Great. Has anybody actually participated in any of these things? Okay, cool, great, couple, not many. I can't encourage it enough. You can actually do these things online free, okay? You're gonna find out that they pertain to everyone in here. You can't avoid it. You can't say that's not me. You can't say I don't fit into that category. That's not the case. Every single person in this room has a dominant perspective and a not so dominant perspective, and you are going to fall into one of these categories, I promise you. As I was saying, these are just two. I tend to lean towards the DISC. This is one that I'm most comfortable with, that I use the most. Myers-Briggs is also fine. By the way, I see you taking a picture. That's fantastic. Take all the pictures you want. But I also, to be very clear, I literally created this PowerPoint presentation with the idea that you guys can download it and use it. I mean, I put way more words in here than I normally would do in a presentation, but I did that with the idea that you can literally take this presentation and hopefully use it for yourselves, either as an individual or as a supervisor or manager in your department to work with your team. So let's go through each one. Dominance. These people are people that are very secure, confident, arrogant, and very decisive, typically not wrong, at least in their minds. Oh, by the way, unfortunately, I fall, or fortunately, I fall. I am a D. For what it's worth, I am a D. Mr. Busticker back there is shaking his head. No, Mike, I know you don't believe it, but it's true. what I can tell you is if I could be reflective, my being a D makes it so that, like I said, I like to be in control. I like to take charge. I'm not willing to fail. And usually people around me are impacted and affected by that. So if you know somebody like that, put those in your head. Let's talk about the next one. Influence. Okay, these people here, they are, as you can see, right, charismatic, enthusiastic, persuasive. Um, they want to be your friend. They want you to like them. They want to be the type of person who is inclusive in the program. They want to be part of it. They want it. All that stuff goes with that. And so they don't care so much about winning as much as they feel like as long as everybody's happy in the process, that's what I want to be part of. Y'all know people like these? This one here, this is one that I'm used to working with probably more so than any, and I've had the most success working with these type of people with the idea if you understand it right. They're very analytical. They like to be participatory. They want to also make sure people are inclusive. But more than that is if you can get them on your side, they're very persuasive in how they get the rest of the team members to participate, right? So an example around this is I used to work with a young lady that was phenomenal, but I couldn't, if I'm the type of guy that says, hey, I just had a thought at 9 o'clock this morning, call a meeting at 10, let's have a conversation about it. This particular lady would come into the meeting and I mean, she was so discombobulated and so put out by the fact that I didn't get a chance to think about this, that she could not function. But if the night before I could give her an email or have a conversation around, look, at tomorrow morning, I'm contemplating doing this for this reason with this kind of an outcome. And she'd come to the meeting prepared, have thoughts, ideas, what it is that we want to do, how we want to do it. I mean, it was amazing. And so I'm just saying, there's power in understanding these things, understanding how people think and where they fall in these categories, and then building a team associated with it. The last one, I'm pretty sure you all have seen and heard and know people like this. These are your analytical people. 9 out of 10 times, they won't make a definitive decision. They will ask for information. You'll give them the information. They'll dissect the information. They'll ask for more information. And they just keep asking for data, but they actually never make a decision. That's okay, because they look at the data in ways that the rest of us don't want to, can't, don't understand. And if you put that person with the right D person, then you can make some really good decisions and head things in the right direction. So it's really critical. I'm pretty sure all of you know people in all of these categories. So here's what I want to focus on. Likely, let me rephrase it. Every one of you fall into one of these categories, right? DISC. That's going to be your dominant. Your dominant feature is the one that is going to be the one where you live most of the time. In every instance, we all have to play in the other spaces. I don't care what the situation is. If you're a technician, a manager, and you've got an opportunity to work on a project, then likely you're going to have to start looking at some data. You're going to have to interpret, analyze data somehow, somewhere. So you're going to have to play in the space. If you want to get along with everyone, if you care to have a team, if you want people to be somewhat satisfied, you have got to be a team player. You've got to be able to live in some of the other spaces at least a little bit. So my point is, all of these things are things that we live in on an occasion, but you have a dominant side. Understand what your dominant side, understand the people that you have that you're working with every day, what their dominant side is. I'm also going to give you another example. If you're having a conversation with somebody, and I'll give you one of my mentors, the man that I respect more than anybody, Steve Canton, if anybody knows who that was. He's been around the industry forever. He just passed recently. Steve was an analytic guy, right? He was the C. Fantastic. But when Steve got stressed, right, like Sodexo would say, hey, we're financially not where we need to be. The customers are upset, this, that, or the other thing. When people get stressed, they go really deep into their space. So, because that's where they're comfortable. So Steve would say, I got to have this information. Man, you spend 2 days putting it all together. You wouldn't have it 5 minutes. Great, I need more. I need more. And just deeper, 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 deeper. Once I understood how he worked and what he did, I was able to present the data in a way that he wouldn't have as many questions, that it would kind of be instructional, informative to where I knew he wanted to go and where he was trying to achieve. And it made our conversations much more successful, right? So all I'm getting at is if you can find a way to do it, if you're a manager of a department, get your team to do this. Help them understand the value of it, because especially if people are having trouble communicating, not talking, communicating. I promise you, you'll be more successful. And just having the insight and the knowledge associated with the categories, where you fall, what you do, it's imperative. Thoughts, comments, concerns as it relates to this before I move on to the next area? Yes, sir, Mr. Allen.
Another great tool that I use with my teams over the years is Strengths Finder. I'll tell you what, it was very powerful to understand where a person's top, what are their top 5 strengths were, and then how the different strengths work well together. Creates a very powerful team.
Yeah, thank you. So as I said, I'm not here to advocate or sell anything, right? I mean, these two that I mentioned, Myers-Briggs and DISC, are just two that, so it started out for those of you that know TriMedics. I mean, as I said, I've worked for virtually every company that's out there. When I was with TriMedics, Greg Ranger at the time had us, we did coaching, and they had us do 360s. And part of that process was in particular the DISC, and that's where I got comfortable with it. But it doesn't matter what tool you use. It's understanding that there's different personalities and different things and how it's best. I can't implore you enough, if you want to be successful, having at least one representative of each of these on a team is a way that you're going to get it, because everybody, then you have a complete package. You're bringing the right, you're making sure that somebody's going to be in charge. You're making sure that somebody's going to look at the data. You're making sure that everybody's going to get along and that nobody's going to be left out and feeling like they're part of the team. And then you're going to make sure that there's a positive outcome. So I can't tell you enough. I can't say enough. Please think about it and see what you can do. Okay, let's go about communication. I know we all communicate every day. I say to you that we talk every day. I don't say that we really communicate very well. And it's hard, it's a challenge, and we'll go through it all the time. And we'll talk about it. So here's a couple different ways that we can do it, right? Direct versus indirect, formal versus informal. These are just probably the 5 categories that are in communication. We're going to go through each one. As I said, think about people that you work with, that you live with, and this isn't just about work and their styles. And as you understand it, I can help you get tools that'll make you more successful. So let's talk about direct versus indirect, right? Let's meet. Hey, can we get together? They say the same thing. They get to possibly the same point. But if you're talking to one individual versus another individual, that's going to be heard 2 different ways. It's going to be perceived 2 different ways. And depending on the environment and the circumstance and the situation that you're dealing with, one is going to be more effective than the other. Assertive, passive, or aggressive, we all know people that are all these different ways, right? People use speaking as a tool to influence. If you're having a conversation with somebody that's maybe not sure of themselves, speaking in an aggressive manner will come off in a really bad situation and can create really bad circumstances. And so being mindful and cognizant of the people that you're talking to and the situation that you're in affords you the opportunity to use the skill set in the way that you want to get the outcome that you're looking for. There are times when you need to be more assertive than another. There are times when assertion is the last thing that you want to do. Formal versus informal, and this is one that I would tell you in your professional world is most important, right? If you're having a conversation with your boss, with administration, even if you're good friends with these people, I would implore you to consider formal in all instances, because as many of you know in our profession, at any moment in time, you could be subpoenaed to talk about a situation around a piece of equipment that negatively impact a person, such as the Safe Medical Devices Act of 1990, and it was involved in an incident, and all of your records are going to be subpoenaed, and it's imperative that you guys come off as professionals. I would just tell you that if you have a choice between formal or informal, and it's a work-related situation, always take formal. But you have the choice, you have options here. And there are times when, as a manager, you're having a conversation with your technicians, informal sometimes is good, but it can be misconstrued at times. And it's really hard, I can tell you from firsthand, it's hard to be your friend and a boss. That's a really hard situation. Just similar situation, just making sure that you're understanding and impacting the situation, right? So here's one that I think from the industry that we're in, which is technology, being very task focused, I think is very important. It helps people understand what the accomplishment and the goal is. It's being specific, being very mindful in terms of what you want the outcome to be, and understanding that you communicate that appropriately. So this one here in our world, I think it's imperative that you understand the difference and that you do what you need to do to make sure that the person on the other end, your technician, your boss, whatever situation, is understanding completely what's going on. Bless you. So to wrap this up from this perspective, we have options. And I think that's what I'm trying to communicate today, right? Around communication itself. It's, you have options. As technicians, we all have a tool bag, whether it's literally a bag or it's a box or it's an electrician's tool belt, whatever the case may be. And in that, we have tools. We have hammers, we have screwdrivers, we have Allen wrenches, we have adjustables, we have socket sets. You have a sundry of tools that you use every day so you can be successful according to the situation and what you got going on. Well, what I'm sharing with you today are also tools. And what I'm telling you, and I can't say it strongly enough, is you can fix a piece of equipment all day long. I can take this remote that's not working, and likely it's just the batteries. Could be that my 3-year-old grandson dropped soda on it and the buttons are stuck, whatever the situation may be, but you can fix it. But what you can't do if you're not successful is you can't communicate that. How many times, listen, I'm just going to give you guys, I've had thousands of people report through to me. I've had thousands of customers that I've dealt with. The thing that I hear the most is, technician's fine, but I don't have a clue what they do. I'll give you an example. I had my very first person I ever hired in my life, 1984, I think, 83, 84. I literally was the advisor to the college, the 2-year associate's degree that I started with. I was on the board, and I had pick of anybody I wanted. And I picked the #1 person in the class. This kid was the most technically competent person in the world. And I got to hire him. It's great, right? Because that's what we want. Let me tell you a little bit about what I experienced through that process. We'll call him Tom for the sake of our discussion. Tom could fix anything. And in candor, if I was the guy that's going to be in the hospital as a patient, I'd want to know that Tom was the one that touched that device last. But let me tell you a little secret. Every time Tom went to a department, every time Tom fixed something, they did not like it. I would get a phone call and they would say, don't send him back here. I don't think he fixed it. I don't think it's In addition to fixing the technical situation, you have to fix the people. And if one of your examples is you walk into an ICU room and the nurse is saying, this dang piece of crap that's up on the wall here that I'm taking care of the patient with, it ain't working, this and that. You walk over to it and there's this thing ONOFF and you switch it and all of a sudden it starts working. Okay? How many times have we had it? We have options here, kids. You can turn to the nurse and you can say, hey, idiot, click. Probably not going to win you a lot of points. Okay? You might have fixed it, but I don't think she's going to ask you to come back. But if you turn to her and said, you know what? I'm really sorry. This is my fault. I should have trained a little bit harder when it came to the program. And then when we sat down and, you know, when you go through this, your startup routine, I would ask and encourage that you consider looking at the switch back here as well as a few other things. You might want to look at the filter in the back, make sure it's not too dirty. And, you know, this, and you have this conversation and you don't make them feel stupid. Not only will you be successful, but I guarantee that you're going to be the one that they call on a regular basis and have a conversation with. So my point is use your tools. And I can't tell you enough, just because you're a really technically competent individual is only barely half the situation. I have a saying that may or may not come off the right way. I can fix a lot. I can teach almost anybody how to fix something. I can't teach people how to communicate. I can't teach people how to read people and how to judge a situation. I can't tell you how important it is. You have to spend the time to do it and do it right. And sometimes it's a challenge. You know, you're going to get off to the wrong foot right from the beginning. And that's when you got to say, okay, let's back up. Let's reassess. Let's figure out what I got to do. Maybe spend a few minutes, try to figure out. There's things that we're going to go through here in a couple minutes that will help you even if you don't have a test, even if you don't have the Myers-Briggs or the DISC. Or there's things that I can show you that you can read in people to help figure out where they kind of lend, where they tend to go towards. And that's what you're going to want to do. So listening, we all listen every day. I would say to you that no offense to anyone in the room, we all listen to respond. We don't necessarily listen to hear. It's a huge difference. And a lot of it has to do with, as I'll explain in a second as we go through this, is it's around where your mindset is at, right? There is somebody that's standing across from you. And I'm staying focused in our worlds. People aren't calling you to tell you that the weather is nice outside. It's raining outside. They're not calling you for that. They're calling you because their world is impacted because they can't do their job of taking care of their patients, which could be you or your family, because their equipment's not running. So right off the bat, they're slightly above comfort. They're already a little charged. They may have had a bad morning. Their boss may be jumping down their throat. Their patients might be all up in arms. I mean, you don't know what's going on in the world, but they're calling you because they want you to help fix it. And you got to be in the right frame of mind to get where you got to get to. And it's hearing what they're saying. And what I will tell you is if you really start to get good at this, you'll read what they're really asking versus what they're saying. It's when you get to the point when you understand that they're saying one thing, but they really mean something else, but they don't necessarily know that because they don't have your background. Their background, using a nurse as an example, is what do I need to do when a patient exhibits these symptoms? And they have a protocol, whatever that may be, disinfect, IV, whatever. And in our world, what do I have to do when this piece of equipment exhibits these symptoms? And you go through your diatribe. Doing the same thing, two different very situations. And it's a conversation that has to happen. So let's talk about the importance of listening and how important it is, because it is. So how am I doing? Okay. So effective communication, building relationships, conflict resolution, and learning and growing. Those are all different listening things, and they all have very important meetings at very important times in different circumstances. So active listening, it's important, right? It's acknowledging. What I would tell you is if you're actively listening, and I think you guys know this, if you have kids, I think you'll understand this. How many times are you talking to the kid and they're not even looking at you, they're already running down the hallway. They didn't hear what you said. That's okay, they're kids. But the reality of it is an active listener does what some of you were doing. You're nodding your heads. You can see the eyes go up, right? I mean, you're engaged. That's what you want to give off. When the nurses, they're already charged, they're already upset. They can't do their job. They want you to fix their problem. The last thing they want to see is, yeah, I hear you. Thanks. Yeah, I'll take care of that. No, don't worry about it. We got it. Yeah, that's not giving them the confidence that you're there. Passive listening, right? Same thing. Yep. Yeah, okay, got it. Yep. Be right there. Take care of it. No problem. Reflective listening to me is really important. It's the value of saying, I've heard what you said. Do I understand what you meant by that? Is this what you're telling me? Is this what you want me to do? That's really, that's powerful. When you get to that level, it's powerful. I can't say it enough. Listening is huge. Distractions, we all have them. I'm gonna go through a slide here in a couple minutes where I'll get into much more detail about a lot of this stuff. But distractions are the thing. I'll be honest with you. I'm probably one of the worst at this, right? I come to the show, I get so jazzed up. I mean, I don't see people for a year at a whack, and it's just a great time. And I'm sitting here, I'm having a conversation with you, but I'm kind of looking like this because I want to see if I recognize somebody else that I know, and that's good. But you don't necessarily get all jazzed up over the fact that, wait a minute, you're not paying attention to me. I got better things to do. If you're not interested in me, I don't need to be interested in you. And it's one thing if I'm here, it's still not a good thing to do, but it's even less and more important when you're talking about a technical situation. And that person that's on the other side of your conversation needs to know, I've got your engagement and you're hearing what I'm saying, and you're going to convince me that you're going to manage the situation and take care of it. Prejudging, this is a big one in our world, right? So you get the phone call, my bedside monitor is doing this. I've seen that 100 times. I know exactly what it is. And 80% of the time, 90% of the time, maybe you're right. But sometimes you're not. And what I would say is don't prejudge, listen to what they're telling you. And then you can either validate that what you thought was right, or maybe it wasn't. Emotions, they play a big part. All of us have baggage. I'll call it baggage. We all have things that we go through. I promise you, whether you're staying here or someplace else, you're at your house. I just live 20 minutes up the road, so I stay at home. I promise you, when you got up this morning, something didn't go away. You heard about something from home, your mom, your dad, your spouse, your kids, something in your world, work, something in your world's rocking it. It is all kinds of stuff that bring into us that are part of our makeup. And so when I go back to either your personality or your communication styles, and you layer this on top of what's going on in your personal lives, that all adds up. It all contributes to our successful ability to manage a situation. And lack of focus, I mean, standing up here, right? If my mind, I mean, I shut my phone off, because if that went off while I was standing here talking, I would lose focus to where I was at, what I was doing, what's going on. And it's just an example. I mean, staying in the moment, staying present, I suck at it. Just gonna be honest, because my head is going every which. I got 20 other things that I got to be doing right now. It's not an easy thing to do, but you got to stay in the moment. It's imperative that you stay in the moment and you get through the situation. I'm trying to get better by writing notes, but man, I got notes everywhere. I don't even remember where I put notes. I got notes for notes. Again, these are just, you're, as I said, paying attention, show that you're listening. That's so important. Showing that you're listening is really important. So if you're having a conversation with a clinical person and you're trying to get through a situation, and if we're looking at some of these examples that we've been talking about, and the person that you're across from you is having a conversation and they're thinking you're not paying attention. You've already set the expectation in their mind that this is going to be an unsuccessful outcome. Think about that for a second, right? You're telling me your problem. I'm supposed to be the guy that's going to fix your problem, but you're getting the sense, for whatever the reason, I'm not engaged in this conversation. You've already started drawing the perception that the likelihood of a successful interaction is probably lessened dramatically. So what that means is, if by chance it's not a perfect situation, you're not going to get a whole lot of wiggle room. You follow what I'm saying with this, right? So the person's already expecting you to fail. So they're looking for reasons for you to fail. That's not a good place to be. Whereas if we're engaged and you believe that I'm really here for you and I want to do it, and then it's not a perfect interaction, it's not perfect, they might give me a little more flexibility. It might be like, look, I know he understood. There must be something that's out of his control, his or her control. And I need to give him a little weight. I mean, you grasp that concept, right? You understand how important it is that you need those people on your side. So the one thing I will tell you is, and this is really important, as I've said, right? Here's another example. I'll use my brother. Some of you may know my brother, some of you don't. My brother is a guy that got into this industry 15 years ago or so. He works for TriMedics. Helped him get the job. My brother doesn't have any background. Matter of fact, I just had a friend of mine over my house. Anybody here from, what do you guys call it? Tellus, I think you call yourselves now, Crothville? Anybody here from Crothville? So you got Stoney Jacobs. Stoney's one of your awesome managers. Stoney came to me 14 years ago, I think is what he said. No background in this business at all. My brother, no background in business at all. They don't have a 2-year degree, didn't go through the military, haven't taken any courses. My brother and Stoney are some of the most successful managers in this industry. You know why? They get this. Perfect example. So I was at TriMedics at the time, and there was a hospital in Amsterdam, New York. Man, it didn't matter. We could have fixed that thing better. It was an x-ray room. We could have fixed that thing better than the day it was designed and installed. That customer just was never happy. No matter what we did, 5 minutes after we walked out of the room, there's another problem. Hire my brother. My brother goes in there. The room was down. I happened to just go visit, a routine visit. The room had been down for over 2 weeks. 2 weeks. If it was down for 30 minutes, I was getting 15 phone calls before. It's been down for 2 weeks. I don't even know about it. I'm like, what's going on? Oh yeah, don't worry about it. Mike's got it. He's taking care of it. My brother ducked him donuts in the morning. He went fishing with the manager. They were friends. And it was a different scenario. Well, I mean, that was one of the most life learning lessons I ever had. If you have them on your side, if they believe that you're engaged, if they believe that you're taking care of the situation, you're going to get leeway like you can't believe. And it all comes from understanding the value of how people listen, how people learn, how people communicate, and you're dealing with it and how it works. I mean, I can give you examples all day long how important this stuff is. If you're doing it, again, it's going to help your, here's what I'll tell you is, I believe this helps you out in your personal lives. If you get to where you can get to, you understand this. I would also caution you a little bit. You go home to your spouse and you start having conversations about, hey, your listening skills and your community. Yeah, I'd temper it down just a little bit. You know what I mean? Don't be too eager about it. Maybe suggest a reading or something, but don't go up in their face. Might not work the way you think he does. All right. So again, don't interrupt. That's another one I'm guilty of. In all candor, 9 out of 10 times I know what you're going to say before you ask it. I know that sounds arrogant, but if you do something for 43 years, you usually get somewhat good at it. But I'm telling you right now, if you cut somebody off, it's not a good thing. Don't do it. Listen, let them say it. and then regurgitate. So is this what I heard you say? Is this what you're expecting? Is this what you want from me? Please, it's imperative that you do it, right? All same things: daydreaming, judging too quickly, guilty, filtering. So this is, if you're a supervisor, if you're a manager, if you have people that work for you, I'm telling you right now, not being a listener is your success is going to be zilch. You have to make your team feel like, I mean, look, if you're in a situation and you're in a leadership position, likely today, correct me if I'm wrong, I mean, raise your hand if in fact you have too many people. Raise your hand if you're paying your people more than they want to make. Raise your hand if you're able to give your people all the training and all the stuff they want to do. Man, no, what's the deal? No hands? Okay, I'm not surprised. But the one thing you can do is you can listen. And if you're really good, you can maybe even find ways to make them happy, right? Because I'll tell you that while money's a great motivator, it's not usually long lasting. You give somebody a big raise and that's wonderful and they love you 3 months, 6 months. And then it's, I want more, I want some. What I tell you is there's other things that'll motivate people. Let them come in a little late. Let them leave a little early. Let them take a day off. And they will be so much more productive in the time that they're there than they would be if they were there for the year by 8, don't leave till 4:49. I mean, okay, do it. But I'm just telling you, if you listen, if you give them opportunities, I guarantee you're going to get more out of them. They're going to be more engaged and they're going to be more supportive. Listening is important. Taking personalities and communication and listening and understanding it all is really important, and pulling it all together, right? And my call to you is listen. Listen, because you'll be amazed at the way you'll see things differently if you actually listen as opposed to just hearing. By the way, I'm not good at a lot of this stuff either. I did tell you I was a D, right? All right, I'm a picture guy. Some people say I'm a big picture guy. Some people say I'm whatever. I am a picture guy. If you want me to learn something, show me a picture. So I'm giving you a picture for those of you that are like me. All kinds of things here to take away. This is huge. Space. When you're having a conversation with somebody, this chart talks about it. Intimate situation, right? It's okay, 18 inches. Personal space. Right? Up to 4 feet, social space, public space. These are really important. And you will find as you're having a conversation with somebody, if you're too far or too close, it will definitely impact your ability to be successful in your communication. And what I would tell you is if you're having a social conversation and you're within 18 inches of somebody, they're going to be very uncomfortable. Promise you. And it's not a good thing. So we talked about, and if you notice, I've always been taught, you got to tell somebody 17 times before they hear it, right? So personality, communication, listening. Here's some of the things that you're going to find out. All those things that I talked about, personality, communication, listening, are wonderful. Your nonverbal cues are probably 50% as important as your verbal cues, maybe more so. And here's some examples. Your distance and things is really important. Your pitch. If I'm coming at you like this, it's a different conversation than I'm having a conversation like this, right? I mean, there's times when you want to do this because you need to make a point, but there's times if you do that all the time, then it loses its value and it doesn't get you where you want to be. This one here, I bet she's not in. I met a young lady last night. This is just fun for me. I was 8, 10 years old, walking with my mom down North Street in Pittsfield, Massachusetts, and she introduced me to her old boss. And I'm 8 or 10 years old, and he says to me, "Hello, young man," and he shook my hand, and I did this, right? Oh, okay. And he looks at me and he goes, young man, I'm going to teach you a lesson. He said, have a firm handshake. Grasp it. I met a young lady last night. She's just trying to get in this field. I wish she was here. She was really cute. She wants to get in this field. And she went to shake my hand. And I'm like, whoa, it was like I don't anybody take offense. I called it a wet dish rag. Not a good message that you want to send if you're in a professional world, right? Be assertive, be firm. So here's something though that you need to understand. And it's hard to show, but if I come at you and I do this, or my hand's on top, I'm basically saying, I'm in control here. Okay? I'm telling you. So when you walk up to somebody and they either shake your hand or you shake their hand and it's on top, you're trying to say, I'm in control. Or they're telling you, I'm in control. It's really important. Don't try to change it, but be perceptive of what they're telling you. Normal handshake, fine, just be firm. Same thing with underneath. So I'm telling you, it's really important because you're going to find when you meet certain people and they do that, there's a message that they're trying to share with you. Eye contact. This is imperative. Imperative. Contact is really important. Now, the thing that I'm going to tell you is this is everyone has seen whatever your political views are, couldn't care less, don't want to know. But I promise you, you've all seen something around somebody trying to run for election or do something in an office. These are true statements, and it's the same in the rest of the world. If you're talking to somebody and that you ask them a question, and as they're answering it, they're kind of, everybody does this, right? They kind of look up. If they look to the right, they're trying to make something up. They're trying to figure out how they're going to respond to you. Now, this is not 100%, but generally, I'm telling you, it's a true statement. And this is why, in a second, I'll tell you something else. If they look to the left, they're literally trying to remember the situation and what would happen. It's legit. But I'm telling you, these are little things that when you layer on that other stuff, have a huge impact if you can keep it in the back of your head and be thinking about it. Head nodding, right? It's important. It's really important. And it's acknowledging it. This is really important. Let's say you're in a situation where you're across from somebody and you're sitting at a chair, right? And even if you're not, but if you're having a conversation and I do this, what do you think? I don't care. To be honest, I don't want to be here. I don't care, right? And there are going to be times when some people are just comfortable folding their hands. But I'm telling you, here's a message that the other person's hearing. Yeah, this person, they don't even want to be here. Don't do it. Figure out a way to sit on your hands if you have to. Because as soon as you do this, if anybody understands this, you just shut them down, and it's not going to be pleasant. All right, hands on hip. It typically means I'm better than you. And here's the deal. Really? Oh, that's great. Thanks. Don't really care. So this one here, thanks. This one here, legs crossed are fine. If I'm having a conversation with you and I just happen to walk across my legs, and that's fine. But if I do this, yeah, I'm not interested. I don't care, right? I mean, can we get this over with? Because I got other stuff to do. Not a good thing. I'm just telling you, true. This one here is my favorite, and it's a true story. You watch politicians on TV, they tell you, I promise I'm going to do this, and I promise I'm going to do that. And then if we do this, we're going to do that. And then they do this. They touch themselves anywhere on their face, their ear, their nose, their chin, their eyes. They just told you something they don't even believe themselves. I'm telling you right now, you have a conversation with somebody. I called you last week. I told you this thing was broken last week. Yeah, that's bullshit. No, they didn't. Okay? These are, you don't need to tell people these if you don't want to, but they're great cues. They're wonderful cues. If you understand how these tools work, you can be wicked but successful. Man, I cleaned that up pretty good. Questions? All right. These are all things that this is a culmination of what we're trying to talk about, right?
For a guy my side in this field, from being a technician to being a manager, those cues mean a lot to people when I come in. My distance, because too close, I can seem intimidating. But far away, people are more willing to listen. My tone, my pitch, me nodding my head and letting them know that I'm understanding, letting them finish their sentences, and then verbalizing it back to them what they just said to me. So a lot of those things from top to bottom resonate with me, just being a larger guy coming into to the ICUs and different managers. Standing over them too much can seem like I'm trying to bully them or trying to say a different thing to some managers. So I like to stay at a distance so they feel comfortable around me. And then also they can verbalize whatever they're saying. So those things I'm talking about verbatim probably are very good that I use.
Thanks, I've done my job. Thanks, Tony. You're right. You're absolutely right. And you know, something we haven't talked about is exactly that, is physical size can be is another thing too, right? I mean, I think there she is. Love her to death. She's wonderful. There's Miss Wendy back there, right? Wonderful sales rep for iMed. She's phenomenal, but and I probably owe you an apology because I picked on you a little bit last night. But the reality is, I mean, she's for what? Right? And she walks in, hey, you guys need to give us your business. Yeah, okay, maybe, right? So it's all has part of it, right? It's all part of the game. But the cool thing is, if you pull the right belt out of your Batmobile tool set, you're golden. You can make it work. These are, again, this PowerPoint is created with the idea you can download it. And that last slide and this slide, to me, are the two things that bring it all together. Culmination of everything that we've talked about here. All right, again, picture guy. This picture is, again, the summation of what I think, and I'm going to walk through it. We talked about personality. We talked about communication. We talked about listening. Then we talk about somebody has a problem. And that problem needs to be communicated to somebody that might be able to help resolve that problem. But there's some things going on. I got a staff things that's going on. I got patients I need to attend to. I'm dealing with compliance issues, whether it's finance because of what's going on in their department, or it's the fact that they have to get so many. I mean, Tim, name me a department today that doesn't have KPIs and productivity and throughput that they have to deal with, whether that's from an HTM, PM compliance, or whether that's from a nursing staff that have to get people turned around. I'm discharging you now. I've got 2.9 hours to get your butt out the door before I get in trouble and put somebody else in his bed. Everyone's under constraints. All that stuff is part of it. And our ability to not be able to help them meet those only makes us look like the bad guy. You got finance breathing down their neck, physicians breathing down their neck. Hey, I got to get this patient in and out of here. You're preventing my patient from getting better faster because you're not doing your job because you don't have the equipment. I mean, there's a lot of crap going on in people's heads that they're just trying to tell you, look, I want you to fix my damn blood pressure cuff, whatever the situation is. We go back to this page, this one here, which is trying to pull all it together. And we talked about all the nonverbal cues and what those mean and what they look like. There's a lot going on. All I wanted to tell you is my damn piece of equipment's broken. There's a lot going on. And your perception and your ability to be able to get back to them, say what you want. Picture pretty much tells it for me. Okay, this pretty much wraps it up. I can't say it enough. Best as you can, understand your own personality, if nothing else. If you can understand the people around your personality, that's a plus. Understand communication. Understand what it means, how it can be impacted, what you can do and what you cannot do, how you can use it, right? Listening. Understand those tools. But if nothing else you take away from today, when you walk up to a situation, somebody says, hey, I need some help, and you're the technician, you're going to go do some help, or your people are going to go do some help. If you do these three things, and you didn't hear anything else I said today, I promise you, you'll be more successful just by doing this. You walk up to them and you say, I feel what you're going through. I understand. I've been in this field for 3 days, but I've talked to a couple people and I understand, and I know where you're coming from. I understand how you feel. You walk up and you say, you talk about the felt, right? You know, just last week, had a similar situation over on 4B. And here's what they found. It may not be even the same situation, but it's showing them that you have some experience and you're hearing what they're saying and it's resonating and you're helping them. I feel what you feel. I have felt and others have felt the way you felt. You're giving them some credence that they're not crazy, right? That's important. And the last one is, we've done this before. Now you've instilled confidence in them. I've done this. I can take care of this for you. I will take care of this for you. If you do these things, this right here, if nothing else, I promise you, you'll be better off. Feel, felt, found. I think that's it. Yeah. Okay. Questions? Thank you. Thank you. Thank you. Appreciate it. Questions, comments, concerns? Yes, sir, Mr. Allen.
One of the keys to good communication is also being able to speak the language. One of the things I encourage my staff to do is there's always clinical training that's going on. They call it new conference in the organization I was in, but they're talking about their clinical processes and what they're trying to accomplish. You attend that, you understand what it is that they're trying to do, you can speak the language. The same thing with IT. There's, for a lot of people, it's an adversarial relationship with IT, but sent a lot of my guys to A+ Network Plus training, and they were able to speak the language, and it just helped those relationships so much more.
Excellent. Very, very correct. Excellent. If you think about it, those of you that went through 2-year program, even if you just went through 2-year program, one of the courses you had to take was, what the heck do you call it? But you have to understand the language, right? And what it means. And so that you can have those conversations. So yeah, it's a great point. Yes, sir.
I just want to bring up, talking about the different groups, one thing I didn't hear you talk about is the generational gap. And there's a lot of that I think that people are talking about, even from an HR perspective, is how we have to communicate different with those different age groups, millennials versus whatever the other groups are. But that is something I think to be aware of, is that how we communicate and how they understand is different.
No, you're 100% right. But as I said, even what I've taught today, those 3 that I've done, those people create careers for those 3. And that one there is another one. You're 100% right. I'm not discrediting a thing you're saying. The only thing I would say is that I think, and by the way, I agree with you, and I have trouble struggling and communicating with millennials and others. No disrespect, no problems from anybody. But what I would say is again, even those, I think if you apply some of these practices, you'll find a way to communicate. But you're 100% right, and it is. I think it's becoming more and more important every day. So, anybody else? I'm sorry. Yeah. Yes.
I was wondering, would you have any tips for like a small business company started?
Yeah. So, in case you couldn't hear, a gentleman asked about ISOs. And it's not independent service organizations. It's the registration. It's the certification. So first of all, if you don't mind, I'm going to take 5 seconds. There's 9001 and 13485. Everybody understand that? Nobody's raising their hand. Okay. All right. Good. Anyways, there's 2 different things. So those of you that have Joint Commission or DNV, Joint Commission not so much. DNV 100%. Almost went like that. DNV 100%. If you're ISO, you have to be ISO if you're going to be DNV audited. And so 9001 gets you through the door. That's your entry point. 13485 gets you service. And I would say to you as an organization, if you're in service, even if you're an in-house program and THR, if anybody's here from THR, they have an interest. Yeah. So you guys have an interest to go to ISO 9001, maybe 13485 at some point. Awesome. And I've given them some names and recommendations, people they can talk to. So the answer is, I would recommend it highly. And if you're going to get into service, 13485, but start with 9001 and get yourself a consultant. And I can give you some names of some people if you're interested. But yeah, I would recommend it. And that's also the other thing, the plus and minus about ISO is it'll help you communicate, but it'll make you communicate and in a certain real focused way. So that's okay, but just be mindful of the fact that it is not a lot of flexibility because you got to make sure that you deliver on certain things. Thoughts, comments, questions?
You may remember our telephone game.
Oh, yeah, that's right. Thank you so much. Okay, so who would be the last one back here I want to talk to? All right, come on, come tell me what it said. What do you got to do? What? Wow. Okay, how about over here? Who's the last one, you or you? All right, well, somebody tell me. Don, what did it say? All right, so here's, man, that's awesome. Okay, so obviously it's exacerbated slightly, right? Exaggerated out, but here, let me just see if I can do it quick. Man, how come you got so many slides? Okay, this is what it said. And she said, oh, by the way, it's broken. Hey, how many times is that how we get it? Napkin, a sticky note, broken, whatever the case is. My point is, this is what it started out as, and we got back to it's broken. Okay, it was meant to be what it is just to demonstrate how important it is that we have communication. And here's the thing, poor communication says it's broken, which may lend me down a path that I'm gonna spend a whole lot more time focusing on trying to solve something that doesn't even have a problem. Whereas if we had a conversation, we might know that and do it entirely different. I can promise you the wrong diagnosis will give you the wrong result. And the poor communication will force you to do things that you might not have to do otherwise in a way that you won't want to do it. So it's how important is it? So thank you. That was fun. Proved out to be a little more than I thought, but okay, that's good. All right. Thanks, everybody. I can't thank you enough. Thanks for coming. I'm available next 2 days. Question anything you want.